Are you experiencing chronic pain? Perhaps you've been to pain management doctors, you've been to lots of health professionals, and you can't seem to resolve this chronic pain that is deeply affecting the quality of your life. Hi, my name is Dr. Ariane Missimer, and I am a functional medicine practitioner, doctor of physical therapy, and registered dietitian. And I've been practicing in the health field for over 25 years. I have seen so many people come into my clinic with chronic pain. And I think that it's so important for you to understand, if you are experiencing this, how your gut, it plays such an important role in not only why pain is happening, but how to improve it. So today we're going to take a deep dive into talking about chronic pain and gut health and pain-free strategies for your life. So first, we want to understand chronic pain. So chronic pain is technically defined as pain over 3 to 6 months in duration of time. Now, if we have an acute pain, let's say, for example, we have an ankle sprain. So you step off a curb, you roll your ankle, you have an acute response. That is your defense and repair mechanism. That is your immune system. So you have white blood cells rushing to the area. You have increased blood flow. So you'll have swelling, you'll have pain, you might have redness. So that is a normal response, exactly what our system is supposed to do. And when we have chronic pain, at this point, there is no obvious tissue damage. So in the case of an ankle sprain, we typically are going to have a lateral ankle sprain where you roll your ankle. And so in that case, you would have compromised the ligament in the ankle. So there was an exact tissue damage that occurred. When we have chronic pain, at that point, there is no actual tissue damage. However, our brain is still telling us that there's pain. There's still signaling that's occurring that's telling us that, yes, there's still pain, there's still pain, there's still something that needs to be resolved. So we can have a variety of different chronic pain conditions. For example, we could have arthritis. So arthritis, especially osteoarthritis, and we can also consider things like psoriatic arthritis, autoimmune, rheumatoid arthritis. These conditions can create this ongoing inflammatory process that can result in chronic pain. The key word here is inflammation. So whether it is autoimmune in nature or it is osteoarthritis, which is inflammatory, itis means inflammation, we want to recognize that inflammation plays a role in chronic pain. We can also have something like fibromyalgia, which can create widespread musculoskeletal pain, even things like sleep disorders and memory and even mood disorders. We can also have something like allodynia, where we can have an increased pain sensitivity. Think of this as a hypersensitivity. So for example, if something brushes by your skin where it shouldn't, in theory, cause any pain, it might create a heightened response of the nervous system. So in essence, as we're thinking about pain, we want to think about how our nervous system is processing the pain. So as I explained, we have acute pain and we have chronic pain. Chronic pain is very unique in nature, where we have a sensitization of the nervous system where it is still sensing that there's pain, even if the tissues have been healed. So now let's talk about the gut's role in pain. So as I mentioned, we have inflammation that's associated with our normal defense and repair mechanism. And we need that defense and repair mechanism, because if not, we would have a whole host of issues. So our immune system's doing exactly what it needs to do. Now let's think about the gut and the microbiome. So we have over 400 million different bacteria living in our microbiome. These bacteria are protective for our immune health, immune modulation. They are helpful for creating neurotransmitters. They are important for digestion and metabolism of nutrients, our therapeutics, our medications, our supplements, and so many more functions. Now, the gut is actually 70% of our immune system. So we have what's called the GALT, G-A-L-T, so gut-associated lymphoid tissue. And we have this specific lymphoid tissue that is affecting our entire immune system, which is really powerful. So if we have any type of gut dysregulation, such as things like dysbiosis, an imbalance of bacteria, SIBO, small intestinal bacterial overgrowth, if we have leaky gut, i.e. intestinal permeability, parasites, poor digestion. So our intestinal health might indicate that we're not digesting our foods well, which means we're not absorbing our nutrients well. So that creates two micronutrient deficiencies and even macronutrient deficiencies, and so on. So what happens is when we're thinking about the gut and its role in pain, it has a massive role in chronic pain. And every patient that I've ever worked with chronic pain and inflammation, we see consistently, time and time again with stool tests, that there is a huge factor in their gut's role in their pain. So when you're really trying to uncover some of the underlying causes of your chronic pain, you do want to look at specific testing. So this could be things like stool testing, looking at specific inflammatory markers like high sensitivity C-reactive protein, homocysteine, looking at sedimentation rate. So there's really specific things that we can look at to get a better picture of this chronic pain and inflammatory cycle. Once you've done that and you have some more information, you can also look at things like a micronutrient panel to understand where might you or someone you love be deficient in. So once you've done this, now we can talk about some of the pain relief strategies that you can use by addressing your gut. Number one seems the most obvious, but is really beginning to address your nutrient intake. So are you eating a diet that is whole food, that is high in fiber, that is going to help with the diversity of the microbiome? So having a diverse and fiber-rich diet can be one of the most helpful things for your microbiome. When you have this, you want to think about intentionally consuming different colors, different nutrients. We say eat a rainbow. That is not just an art, but that is a science. Being able to eat all of the different colors that are providing you with nutrients, phytonutrients and antioxidants that are going to help mitigate oxidative stress. So they will help to mitigate that inflammation, that ongoing inflammation that you might be having that's impacting your chronic pain. Consuming essential rich fatty acids. So your omega-3s are going to be really important here. So this is going to come mainly from your fatty fish. So that can be things like salmon, that can be things like mackerel. Those are going to be really important in healing from your pain that affects your not only inflammation, but membrane health and ultimately mitochondria. Herbs and spices can be really powerful. So this can be things like turmeric, this can be ginger, cloves, rosemary, all can be great. You can add them into your diet. You can also do them in some supplementation form. And depending on what you're finding from your potential stool tests or really looking in a little bit more depth, this is where you want to think of a specific gut protocol to address any underlying infections or dysbiosis or inflammation that might be occurring in the gut. If you don't address these things and they continue to persist, they most likely are going to continue to drive inflammation and therefore chronic pain. So as a functional medicine practitioner, physical therapist, I'm seeing people with chronic pain all the time. I always say it's really important to address both. There's a mechanical component most likely to your pain. So for example, if you've had neck pain for 20 years, yes, most likely the tissues have changed. There's tightness. It could be degenerative changes in your spine. So there's always a mechanical component, and it's very important to address that. So that could be through specific exercises, maybe things you've tried already. That could be through changing your movement patterns, improving your compensation patterns. But there's also this other part of it that means looking at the underlying causes of why you have chronic pain, why you have chronic inflammation, and therefore the gut is pertinent in that. The next thing to consider as it relates to gut health and pain is movement. So you want to think about movement coming from a graded perspective, meaning too much, too soon is going to set you back. Movement is something that can help our digestive system, and it can help us with our nervous system, and it can help with our mitochondria. So it is one of the most powerful things that we can do to influence chronic pain, but it has to be purposeful and graded, meaning if you are going to start walking, you're not going to start walking for an hour. You should start walking for 5 to 10 minutes and then slowly progress that as you feel confident in your body and you feel good and you let your tissues adapt to that new stressor. And then last but not least is your nervous system. So there are so many different ways to address your nervous system. That could be through walking. That could be through hugging a friend. That could be through yoga classes or movement. But the key with understanding chronic pain and how to address that is definitely addressing the nervous system. If you have had a history of trauma, you can check out my recent video on that. Then that is also going to be an important factor in addressing. If you have ongoing stressors, it's not so much we're getting rid of stress, but we're learning how to navigate through stress. And so make sure that that's top of the priority as it relates to healing your pain. So I hope you can appreciate the role of your gut health in your chronic pain. And please make sure that you know that you can take actionable steps to heal your pain. Yes, it might be challenging. And yes, it is a journey, but there are things that you can do to really begin to unpack that. And if you are not able to do stool testing, if you're not able to do any testing for that matter, start with some of the things that I mentioned about optimizing your nutrition, your movement, your nervous system, your sleep, to really begin to shift your gut microbiome, shift the state of your body, bring it back to homeostasis, and begin to heal from your pain. If this was helpful, please make sure to give it a like, give it a share, comment below, and of course, subscribe to our YouTube channel, The Movement Paradigm, for weekly tips on mindset, nutrition, and movement. And if you would like help on your journey, if you feel like you need an individualized approach, please reach out to us. We would love the opportunity to help. If you feel like you want to have access to all of these things, then please check out our app, The Movement Paradigm, on Apple or Google, and you can have access to lots of programs on somatics and vagus nerve exercises, as well as movement programs to make sure that you can really optimize your wellness.